Good afternoon, everybody, and welcome to the City of Toronto's 2019 COVID-19 media briefing for Thursday, April 16th, 2020. Joining us today, Mayor John Tory, Toronto's Medical Officer of Health, Dr. Eileen, and Toronto Fire Chief and General Manager of the Office of Emergency Management, Matthew Pegg. Chief Pegg does not have any formal remarks today, but is here should there be questions. Likewise, Paul Raftis, our Interim General Manager of Long-Term Care, Senior Services and Long-Term Care, is also here. And Marianne Bedard from Shelter Support and Housing is on the line should you have questions for either of them. Mr. Mayor.
Thank you, Brad, and good afternoon. May I start today by acknowledging the fact that Prime Minister Trudeau announced help for small business today in the form of the Canadian Emergency Commercial Rent Assistance Program. And I will just say that this is very welcome news for the small business community here in the City of Toronto. It's something that I had spoken about directly with the Deputy Prime Minister and the Minister of Finance, and I believe that if rolled out quickly in cooperation with the Province of Ontario when it comes to Toronto's case, it will make a real difference in saving many small businesses here in the City of Toronto. I know that small businesses need help right now, and this shows the federal government is listening. And I think that this program, when it's fleshed out, will provide more of that kind of assistance they need. I continue to encourage landlords to work with their small business tenants to find a way forward together. Evicting someone who has paid their rent up until now at the time of this emergency won't make good business sense in the long run, knowing that many landlords, many small landlords in particular, have their own financial challenges. I continue to believe that a provincial ban on eviction of commercial tenants during the emergency makes sense. The city tax deferral and today's new federal support, which will be delivered by the provinces, should help people stay in business and get through this crisis that is no fault of these hard-working, enterprising tenants or their landlords, for that matter. For our own part, we are rolling out initiatives at wartime speed to help residents and businesses who need that help now. That includes doing everything we can to help small businesses. They are the backbone of Toronto's economy and the country's economy, and their success when we restart our city will be key to restoring the strength of Canada's economic engine. Today, I am pleased to announce the expansion of the city's digital Main Street program to help local businesses develop or expand their online services during this unprecedented time. When the city moved to lock down as much as possible under the advice of our public health professionals in order to save lives, many businesses suddenly found themselves in need of a much more in-depth online presence. In response to this crisis, more and more services had to move online, and this makes the Digital Main Street program uniquely positioned to help businesses jump online or expand their existing online sites. This will not only help these valuable parts of our neighborhoods to survive, it will also allow more of us to get the services we need online from a local source so that we can stay home as much as possible. As you may know, the City of Toronto partnered with the Toronto Association of Business Improvement Areas, known as TABIA, in 2016 to create Digital Main Street to help Main Street businesses, so important to the strength and vitality and health of our neighborhoods, to help those businesses grow their operations through technology, principally being online and having some e-commerce presence. Working with TABIA and with other community and corporate partners, Digital Main Street has helped businesses with everything from their websites and social media to launching e-commerce platforms. We're expanding this program at a crucial time for Toronto businesses by tripling the budget. And this money will be used to expand our digital service squad that will be available to support Toronto's Main Street businesses through one-on-one, now virtual, support. Businesses will also have access to online tools, connection to trusted digital vendors, and online learning to help them to continue to grow and thrive even during these unprecedented times. Since its launch, the Digital Main Street program has engaged more than 6,000 Toronto businesses and provided direct one-on-one support to more than 2,100 of those businesses. It has delivered more than 9,200 hours of support and training and education. Prior to working with Digital Main Street, 30% of businesses had no online presence at all, and now they do, and 66% of businesses expanded their online presence, and this will be particularly beneficial to them at a time when people can't walk in the front door of the store, and of course it opens them up to customers that are in far-flung places outside of the City of Toronto. Just think how many more local Main Street Toronto businesses will be helped now at a time when they truly need it the most through the expansion of this Digital Main Street program. Local businesses can learn more about the Digital Main Street program by going to digitalmainstreet.ca/Toronto. We know that the impact on the economy of this pandemic is taking a devastating toll on Toronto residents and on businesses. I know that our small business owners are frustrated and stressed right now. It takes courage and grit to start a small business to begin with and to build that business from the ground up. And I know many small business owners are drawing on that same courage and grit right now to find a way forward, to find a way to keep the business alive, let alone to turn a profit, and to find a way in particular to support their own families and the families of their employees. I want you to know that your city government is doing everything it can. I am doing everything I can as mayor to help our small businesses get through this, to advocate for them to the other governments in our country, and to make sure that the city is there to support them. The expansion of the Digital Main Street program is just one example of work the City of Toronto is doing in full cooperation with our partners in the provincial and federal governments, the business community and the nonprofit sector to minimize the impact of this terrible virus and to see an economic recovery take place as soon as possible. Today, the City began to implement the province's emergency order limiting work to a single long-term care home. This strengthens action the City itself took last month. Since mid-March, senior services and long-term care, based on the advice of our medical officer of health, have been very forthcoming with staff members, asking them to choose the City as their primary employer so that we can limit work locations and thereby minimize the risk of exposure to COVID-19. To assist staff in their decision-making, the City has offered additional hours, up to full-time hours, to part-time staff and has posted an 18-week schedule. The provincial order, introduced this week, restricts all long-term care staff from working in more than one long-term care home, retirement home, or health care setting, beginning at 12:01 a.m. on next Wednesday. Starting today, staff working in one of the city's 10 long-term care homes will have to sign a declaration confirming their decision regarding a single employer. For those unable to commit to the City, they will be placed on an unpaid leave of absence for the length of the emergency order. Their position will remain secure. The City is planning and preparing for changes in available staff from this order. But senior services and long-term care has already stopped all non-essential services and redirected resources to the essential long-term care operations. For example, we maximized part-time frontline staff and are using overtime to meet staffing needs during outbreaks. We've hired 50 nursing students and PSW certified individuals to support and backfill personal support worker positions. We've also received 80 redeployed staff from elsewhere in the public service from other city divisions and have another 80 starting soon and have requested more through the Emergency Operations Centre. I want to make note of the fact that some redeployed city staff have agreed to be redeployed to locations where there have been outbreaks, and I want to just salute them and commend them for doing so. I want to thank all of our staff who continue to work in our long-term care homes for their service during what I know is a very difficult and challenging time. The impact of COVID-19 on long-term care homes is being seen across the country. It is tragic, and we will do everything we can as a city government to work with the province and with the federal government to help people, principally to help the residents, to help and protect our staff and to save lives. We will get through this, thanks to the hard work of the staff on the ground in these homes, and I thank them again for their heroic efforts. I hope this update offers another indication of the comprehensive effort that your city government is making to protect health and save lives, to protect the healthcare system, and to limit damage to our economy and to our way of life. That continues to be our mandate each and every day. And I will now ask our Medical Officer of Health, Dr. Eileen Davila, to give her report for today.
Thank you, Mayor Tory, and good afternoon, everyone. As of 12:30 this afternoon, there are 2,881 cases of COVID-19 in Toronto. This includes 2,559 confirmed cases and 322 probable cases. There are 230 cases hospitalized and 88 in intensive care units. In total, 147 people have died of COVID-19 in our community. Please join me in extending sincere condolences to the families and friends of all individuals who have died from COVID-19 in our community, and in wishing a speedy recovery to all those who are ill. We realize that everyone is worried about COVID-19, and I am too. I also know that you want more information about how this new virus spreads and how it is impacting our city and our loved ones. As I shared during yesterday's media briefing, I hear you, and I appreciate your interest in these emerging details. My team is working beyond maximum capacity each and every day on our response to this issue and to make more timely COVID-19 data available to you. We are doing this alongside our intense efforts to respond to the evolving global COVID-19 emergency. Data is core to our work in public health. It helps us to understand infectious diseases, to inform strategies to respond to complex issues, and actions to protect our health. Case and contact tracing reports provide us with some of these essential details to help us limit the spread of virus. This information gives us insight into how a virus is transmitted from one person to another, how easily it may spread, how long it might incubate, and how it can impact our health. Other important data collected include such things as symptoms, testing results, hospitalizations, deaths, and experiences in other jurisdictions. Analyzing data gives us a better understanding and a clearer picture of this new virus, which helps to inform our actions to protect your health. We are living through an unprecedented global pandemic caused by a new virus that was unknown to us just 4 months ago. We must actively listen and be nimble and diligent in applying our learning as we go. In the case of COVID-19, we have never seen this scale of contagion and impact, both on people who become very ill and on our health system. I have shared with you previously that we have been entering our COVID-19 case and contact tracing data into the Provincial Integrated Public Health Information System that is known as IFIS. IFIS is a provincial information system that all local public health departments are required to use to report infectious disease information to the province. While IFIS has served us for many years, for the purposes of the current COVID-19 emergency, we at Toronto Public Health quickly realized that this provincial information system was not well equipped to deal with the scale of the data we need to quickly input. When we realized these limitations and that we needed more nimble technology for our response, we quickly worked with our city partners to develop a new information technology tool to keep up with our evolving contact tracing demands. I'm pleased to report today that our new information system, the Coronavirus Rapid Entry Case and Contact Management System, is now live. This new web-based secure system, a first in the province, allows our team to quickly and easily document each individual case investigation efficiently and share data with the Provincial Ministry of Health. It will allow us to better keep up with the volume of new reports and to prioritize individual cases that require urgent follow-up, like cases in healthcare workers. Importantly, this system also allows more of our frontline staff to work remotely from home. While the system is for internal purposes, and will not be available publicly. The information it generates will be used to share more detailed analyses with you. The new system was launched today, and while we have done everything to prepare and to support a smooth transition, we are also prepared for potential technology transition hiccups that may occur. I would like to sincerely thank all of our city partners, especially those from the Technology Services Division at the city, for this unprecedented and innovative collaboration to respond to a significant need in a very timely manner. My team is truly excited to work with this new technology solution that will improve and streamline our work. Lastly, I have been receiving many questions about the situation at our supervised consumption service located at the Works. In March, we made the difficult decision to temporarily close this critical health service. This was upsetting for all of us, given the current overdose crisis, which has persisted throughout this pandemic. And in fact, in March 2020, we saw the highest number of suspected opioid overdose deaths recorded in any month since March 2019. We made the extremely difficult decision to temporarily close our supervised consumption service for health and safety reasons. We know that COVID-19 spreads more easily in congregate settings, and the Works Clinic was not well set up for appropriate physical distancing. Many people who use our supervised consumption service are also more vulnerable to severe illness from COVID-19. And in addition, as I shared with you previously, last month we identified a case of COVID-19 in one of our staff members at the Works, who is thankfully since recovered. But with all of this happening, we needed to temporarily close the service to reduce the risk of further virus spread. I know that this has been frustrating and worrying for many, myself included. I know that it has been frustrating that we have not yet been able to reopen the supervised consumption service at the Works. But the team is actively working to identify solutions to quickly resume providing these critical life-saving services that are provided at the Works, and ways to address physical distancing challenges. Right now, my team back at Toronto Public Health is working to establish an appointment-based model for our supervised consumption service, and we are aiming to reopen this weekend. In the meantime, we continue to provide harm reduction supplies through the Works and encourage our clients to visit other local harm reduction services in the city. Many of you may have noticed that fencing has been installed at the front entrance of our office located at 277 Victoria Street, where the Works is also located. We did this to support physical distancing measures to protect our clients and to protect our staff. These fences will remain for the foreseeable future as part of our response efforts to the COVID-19 emergency. We will continue to update the local harm reduction community on this matter as the situation evolves. My goal in these daily briefings is to share key information that you need to know about COVID-19 in our city. I know that this is not always as fast or as detailed as you may want. Please know that we are doing everything we can to keep you informed, and I thank you for being forthright in your need for more information. In the coming days, I will soon be sharing more data with you. In the meantime, the most important thing you can do to protect yourself, your loved ones, and your community is to continue to stay home, stay safe, and take care of each other. Thank you.
Thank you, Dr. Davila. We'll go to questions now, starting with Mark Douglas from 680 News. Go ahead, Mark.
Thanks, Brad. Dr. Davila, you mentioned how this other data system was inadequate, but was this a change in Toronto's data collection and reporting also spurred on by some kind of public demand, or perhaps was there something about the science of the study of the virus that changed, that made you want to collect and report data differently?
So it's not really a question of collecting data differently. What we did was we recognized that the circumstance in COVID-19 and the kind of response we needed to effect, given the large volume of data, required, frankly, a better system, a more modern system, and one that was more suitable to the needs of this particular situation. So to my mind, what we were doing at Toronto Public Health, and we have a really incredible team doing communicable disease control at Toronto Public Health, they have always been one that has looked at the situation that we have in front of us and adapted and changed the plan, changed service, changed how we do things on an as-needed basis. We saw a need here, given our current circumstances, and responded appropriately by developing a new technology system to better support our work, given the volume of data and the rapidity with which we needed to enter it into a system and be able to use it.
And then a follow-up, well, not so much a follow-up question, if I may, in fact, to just change topics almost entirely here. A question for Mayor Tory, or perhaps Chief Pegg, if you might be the person to ask this one. But have City Hall inspectors noticed any price gouging lately in Toronto? If so, what industries or what stores, if you're allowed to mention those? And if not, are we seeing this as a sign of sort of good old-fashioned Toronto with a good spirit, or perhaps just haven't caught price gougers yet?
The chief, I don't think, is aware of any either, and nor am I. So while we haven't seen evidence through the various people we have out there in the field of price gouging, I can assure you that if it was happening, we would hear about it. Because when it comes to, for example, complaints about people not self-distancing, physically distancing themselves in parks, we get hundreds of calls. And that's not to say that there's a culture of, tattletaling on each other in Toronto, but people certainly are not hesitant when I think it comes to a matter of life or death to call us. So I think if they were experiencing a lot of this price gouging, we would hear about it, but that's not to say it's not happening.
Thank you.
Okay, thank you, Mark. We're just, ladies and gentlemen, we're just having some technical challenges right now with connecting audio, so if you just give us a moment, we will we'll get back to you just as soon as we can. We're just trying to work through some issues here on the WebEx. Okay, while we sort this out, I think Matt Bingley from Global has a question that his camera operator, who is here, is going to ask on his behalf. So, Chris, if you could, please.
Dr. DeVille, do you have any updated numbers on infections for healthcare workers, long-term care setting? I don't think we had an update on total numbers, or we did get numbers in the past, but we haven't had them updated recently. Do you have those numbers?
So Brad, would you like me to repeat the question so it's said through the
Yes,
microphone?
please, Dr. Davila, that would be helpful.
So there was a question being asked by Matt Bingley through Chris, thank you, about long-term care homes and workers in particular. So Matt, thank you for the question. What I have for you today in front of me right now is that I know that we have 41 long-term care homes that are in outbreak, and that there have been 92 deaths recorded amongst those homes, unfortunately, and 13 retirement homes that are also in outbreak right now, with 3 deaths reported in those settings. I do not have in front of me the details in respect of long-term care workers and the number of cases, but I'm certainly happy to take that offline.
Okay, what we're going to do, reporters, is if you could text me your questions, I'm going to ask our friend Chris here to ask them on your behalf, and we're just going to get a microphone to him. So if you text me, we'll get your questions answered while we try to resolve this issue online. So bear with us for just a moment, please. Okay, while we set that up, we do have one, we did get one link. I don't have a name. Phone number starts with 996. Go ahead and ask your question, please. If you could just identify yourself. Thanks.
That's actually Marianne Bedard on the line.
Oh, hi, Marianne. Okay, well, I'm sure you don't have a question. Just bear with us. Sorry about this, folks. This is technology in action and live media briefings. Okay, we have a question from... Okay, we have a question from Mark McAllister that Chris will read on his behalf. Go ahead, Chris.
I guess this is for the mayor or for Chief Pegg. Any response to the TTC union's call for more masks from the city's stockpile?
Well,
If you're the meeting host, enter the host.
Sorry, Mr. Mayor, go ahead.
The union and the TTC have been working on this, and the TTC, certainly through the chief executive officer, have indicated that they're trying to find a solution to this. These people, the operators, have been doing a great job for us keeping the city moving during a period of time that's been very stressful for everybody. The commission had indicated that people could use their own PPE, but now they're sitting down and trying to resolve an issue that was, frankly, indicated not to be an issue by the Ministry of Labour, but nonetheless, they're working right now to find a solution to this that will be satisfactory and keep everybody safe. The commission's taken quite a few steps to do things like installing plexiglass separators, having people board through the back door, limiting the number of people who go on vehicles through having an adequate supply of vehicles, but this is an ongoing matter that obviously is under careful discussion by the management and the union together.
I had a follow-up for Dr. Davila. You're talking about how your team has been working beyond capacity. Do you need more staff? Do you need more help to achieve these goals of getting more data to the public? Do you need more help for that?
So thanks for the question, and the question was regarding the need for assistance or further help at Toronto Public Health, given the remark that I made about the team working beyond capacity. So what I'm suggesting is that, in fact, our team is working very, very hard. We do have sufficient resources at this time, and the issue is trying to make sure that you bring people on board and to help in the efforts to respond to COVID-19 in a very coherent fashion, and it has to be done in a very organized fashion. So we have to train people amongst our own staff in order to help out with the response. And so what that means is that those who are most expert, those who are most regularly involved in communicable disease control and in managing infectious disease outbreaks, those are the members of the team who are most relied upon in these kinds of circumstances. So while I appreciate the concern that Matt might be expressing through his question, I would assure him that thus far, while we are very busy, we do feel that we have sufficient resources, and in fact, the city and our partners throughout the city have rallied around us and offered us an incredible amount of support. That's why we were able to put together in record time a new technology system to help us better respond to COVID-19.
A question for Dr. Davila from Dave Ryder from the Toronto Star. Can you share your thoughts on the direction from the Privacy Commissioner to share as much information as possible that doesn't identify individuals?
So thanks for the question. I wholeheartedly, support the notion of providing as much information to the public as possible, while at the same time ensuring that we're respecting the privacy of individuals. As I've spoken to many times throughout this outbreak and throughout this emergency, it is important that our public is aware of that which we're doing and understands the circumstances that we're in this emergency. But of course, there are ill individuals, many of whom are hospitalized and many of whom, unfortunately, have lost their lives to this disease. So the question is, how do we make sure that we're providing that information in as open a way as possible? But of course, that means still respecting the privacy of individuals and allowing them the space to recover.
Just get reset here. This one's for Mayor Tory from Dave as well. Any update on the financial impacts on the city? Vancouver has a plan to cut regional transit to deal with revenue shortfalls. Does Toronto have any plans like that?
I will be beginning the process of indicating to the public the extent of our financial challenges probably tomorrow, and laying out the scope of the problem, which is not insignificant at all. What we're trying to do right now is to fashion solutions, and we'll talk about the beginnings of that because we've been well underway with this work, but it's not simple, of trying to find a way to get the help from the other governments, quite frankly, but also in our own house to maintain services that we provide to the people of the City of Toronto, notwithstanding that we have some real financial challenges in front of us of great significance. So we'll have more to say about that tomorrow.
A question from News Talk 1010, I guess for the mayor. Any update on discussions around High Park with the cherry blossoms coming up, sort of, I guess, crowd control and enforcement, shutting down the park?
Under the leadership of our very capable Parks and Recreation staff, there's a plan that's pretty well completed now, and as soon as it is complete, we will share the details with the public on that, but suffice it to say that we hope people will not make plans to go and see the cherry blossoms when they're in full bloom, and that we are working very hard on making sure we have arrangements to keep people safe and to try to limit the number of people who can be on site there, but also to make sure, as we said we would try to do, to make some sort of a streaming service available so people can virtually, as they're doing many things these days, virtually enjoy the magnificence of the cherry blossoms in High Park and in other parts of the city where they bloom as well.
Also from News Talk 1010, I guess for the mayor, what was the outcome of a meeting today on possible construction projects that might be able to be sped up while traffic is lighter and less people on the
I think that meeting's actually happening tomorrow, but I'll just say what we intend to achieve at the meeting is a couple of things. One, we would like to see if there's a possibility during this time of much quieter traffic and quieter levels of activity in the city, whether there are opportunities for us to speed up projects that are ongoing on both, all major kind of transportation infrastructure. And secondly, to see if there are projects that we would have undertaken much later in the year that we could in fact do now, whether it's a paving project or something like that, where it would have necessitated the closure of lanes of traffic during times when we do have a rush hour, when we don't really right now. And so I'm going to receive a presentation on that, and we can hopefully decide on some of those projects that we can indeed move to deal with them now while things are quieter in the city.
Okay, just for Dr. Davila next. From 680 News, a bunch of listeners had talked to them via their webpage, and the question about, is it safe to get coffee at drive-thrus? And I guess all sort of drive-through takeout. Is it your thoughts on the safety issues there?
Well, thanks for that question. The safety issues really revolve around establishing physical distancing. This is the most important thing. So to the extent that you're able to maintain physical distancing, trying to keep that 6-foot distance or 2-meter distance, that's really the safest thing. Of course, as we have spoken about many times at this table, Where possible, stay home as much as possible. If you want to ensure safety for oneself and for the rest of the community, this continues to be the core message. We recognize that people do need to get out for essentials, whether we're talking about food and groceries or medications and the like. However, we are still encouraging, stay home as much as possible, and if you need to go out, to ensure that you're practicing physical distancing.
Extra question for the mayor from 680. What are your thoughts, impact on Toronto if U.S. President Trump opens up the border in the next few days? What sort of impact would Toronto feel, do you think, from that border being opened?
Well, there's a lot of commerce that takes place and people who visit back and forth, but I guess the real question we should be asking ourselves nowadays is not placing that first, but rather placing public health first. And so I'm sure that our medical officer of health would have some view on that, but I would think that right now we're still at the stage, because we haven't even indicated that it's time to open our own city up yet, let alone start letting people in from elsewhere, that we should be going very slow on that, and that we should be protecting the city and making sure that we make all of our own efforts here to self-distance and physically distance from one another and keep people as isolated as possible. I haven't had the all clear from the medical officer of health. We haven't even had a discussion about that yet. We've begun some planning, but I guess President Trump will do what President Trump does, but I would just think that those kinds of visitors coming, notwithstanding the business importance, wouldn't necessarily contribute to our efforts to fight this virus here at this moment in time. I'm sure the Government of Canada will have something to say about that on behalf of all Canadians.
Okay, that's it for the questions that I got via text. Again, my sincere apologies to everybody on the line. We will resolve this for tomorrow, and thank you to Chris from Global News for asking the questions on your behalf. Thank you, everybody, and we'll be back again tomorrow at 3:45.
Good job there, Chris.
Yes, thank you,
Good job.
Chris.
Thank you, Chris.